What were your symptoms before the surgery?
I had pain that would radiate around my chest,
Mhm.
and breathing made it worse.
Mm-hmm.
It was just constant. There was nothing that would make it go away, ice, heat, whatever.
1 to 10, how bad was that pain?
At times, it could be up to a 7 or 8,
Mm-hmm.
and there was just no relief for it.
How
There was
long
no
did you
way I
have-
could lay or,
How long did you have that pain?
probably more than 5 years.
5 years. Something has happened in your spine, in your back. What happened there?
Well, I was told I had degenerative disc disease, which was
Mhm.
hereditary from my mom's side of the family.
Yeah, but as well, one of the bone had collapsed, right?
Yeah.
You remember that?
I don't know.
Yeah.
When I was in my 20s, I was
Mhm.
sledding down a hill and I fell off the saucer and landed on a pile of
Yeah,
ice. Could have
yeah.
been then.
Yeah. Now, what practically happened that, you had 3 bad discs
Hmm.
that were pushing on the nerve that goes around the chest,
Right?
and that was what giving you the pain, and we tried everything and you weren't getting comfortable.
No.
And this has been going on for so long, but then we decided we want to go and fix those discs.
Hmm.
Did we get any other tests to prepare you for this procedure?
I had the discogram,
Okay.
and I previously, the physician who had done my first lumbar fusion was not willing to fix my thoracic spine, and it would have been the open procedure.
Did he tell you why he wasn't willing to fix your thoracic
He
spine?
said they reserved that for trauma patients, and
Mhm.
it was such a big surgery, so I just felt like there was no hope.
Now, that kind of surgery is truly a big surgery,
Yeah,
where
it
we
is.
crack open your chest, we sometimes even resect 1 or 2 ribs,
Mhm.
collapse your lung,
Mhm.
go actually do take the bad disc out and then put a spacer in. That is a massive surgery.
Yes,
And that, I totally understand that your doctor didn't want to do that.
and I didn't want to have that either.
But we didn't have to do that surgery.
No.
Can you tell me about what the surgery that what do you remember about it?
I just remember, well, one mistake I made is I didn't take the Toradol because I thought I couldn't. So I had quite a lot of pain, but once I got Toradol, it was amazing.
Yeah. So your surgery was about 5 months ago,
Hmm.
and we did a 2-level fusion, what we call the thoracic in the body fusion, that we invented actually, that surgery, where we got a small incision, multiple small incision in your chest area. We took the bad disc out, put a spacer in, actually 3 levels. So that was a big surgery. So 3 spacer, 3 disc, 8 screws, and internally braced everything. This is the record of the surgery. We did that surgery in 91 minutes, and you stayed 2 nights in the hospital. Now, blood loss was less than 100 cc, which is nothing for this kind of surgery. You did not have to go to ICU after that surgery.
No.
And how is the back pain? How is the back pain in the chest? And how is the pain that was turning around?
I haven't. None.
None. It's all gone.
Yep.
Now, when did the pain that was turning around the chest, when did that go away?
I would say within 3 weeks. I mean, it got better right after surgery, but by 3 weeks afterwards, it wasn't bad at all.
Good. Well, this is actually your spine, and we see that the whole area is now growing to a block of bone, which we call fusion. And I'm very happy with that here in the front as well. And here are the screws that we put in your spine here. And all the spacers, all the screws are in a perfect position. And the bone growth is actually pretty advanced. So just 5 months after the surgery, for all practical purpose, the fusion is adequate. And we can expect you to know that for the bone still you get stronger, but that is actually pretty good. Now, how is your daily activity?
Well, I have a whole household to take care of, and so, gradually I'm doing more and more, and I'm looking forward to being outside to walk more.
Yeah.
So yeah, I mean, to be able to face the day and not have that pain it's just amazing.
Yeah, well, now I know you did some research about the alternatives and
Yes.
so on. Now tell me about, in your research, what did you find out about what the options were before the surgery?
Most everything was that big open procedure, and not that I feel old, but at my age, it's kind of like, well, you're kind of over the hill. We're not going to take the risk on you. So,
Yeah.
so it's like, well, I'm still young enough and active enough. Don't write me off. I need help.
Absolutely.
And so I did the research about minimally invasive, and so that's why I found you. And I thought, I don't think he's going to write me off because he does surgery on older people.
Yeah, and the reason I can do the surgery on older people is not that my colleagues don't want to help older people, but because when you get older, the risks are higher. Your recovery is longer. Your body has less resources. And a massive 8-hour surgery with half a gallon of blood loss, that might literally damage you more than it would help you. Whereas a 1.5-hour surgery with 100 cc of blood for a 3-level fusion, that's still doable. And then what as well I think is important, that it's so important, especially when we get older, that we are on our feet, that we move around.
Right.
If we stop moving, our body deconditions, and it accelerates going down the hill even more.
Yeah.
So it's important to keep you on your feet. So activity is actually good for you, and I think we could put you back on your activity to keep your heart and lung still active and going.
Yep.
Well, any other question? Any other comment?
No, it's the best thing I did.
Oh, okay. Well, thank you so much. I really appreciate that.